Now, Minister, you have a plethora, I should refer, a plethora of ministries.
Yeah.
And what plans do you have, let's say, in the next year for your ministries? Anything new? What are your priorities? Can you outline some of those?
You know, the Ministry of Health is an important ministry to me. Very important ministry. And before I became a minister, I was an advocate for comprehensive coverage, healthcare coverage and delivery. Since I'm the minister, I have come to understand even better the need for this comprehensive health coverage. But more importantly, I've come to understand that all of the elements have to work together. We already provide care to children and elderly and so on. We know what to provide. But there are some things that must be reformed. We missed an opportunity, I would say, to have a fundamental retreat that we were planning, but we're looking forward to that. Because health has got to be reformed so that every person, no matter their status, must be able to access health care in this nation or even abroad. That is why we have supported what the OECS has encouraged in Antigua with a new cancer center there. One of the benefits of that cancer center in Antigua for the people in St. Kitts is that whether you go there for 2 weeks or 10 weeks, we who are government-related patients will be only charged a flat fee of $10,000 US. When you compare that for cancer treatment in Antigua, which could be $10,000, and supported by an oncology unit here in St. Kitts, we are working very hard in this budget cycle to ensure that we get an oncology unit and an oncologist on board, because more and more we are seeing our people with cancers and kidney disease and so on. We're seeing people with that. There are at least 5 people I know who worked for government who died from cancer in the last 5 years, right? And so we are working to because I saw some statistics recently, Mr. Williams, where 2 individuals used up the entire medical program of the government, $750,000 on cancer. But if we have the facility in Antigua and the supporting cast here in St. Kitts, we believe that we can reduce the cost of delivering that service to the very needy. Because what that means is if you're not in the realm of being able to take the medical scheme of the government and go to North America, you pine away and die, you suffer. This new program, and that's what we're working on. So we hope to have an oncology unit, for example, set up through the year next year with an oncologist to continue with certain services that we think that we need. And so the Ministry of Health is, I talked about reform. There are a number of things that could go into it which would require us to have reform. Things, for example, and I hope that some of the doctors are listening to me when I say this, because we have an institution called JNF. And the JNF, when you look at what the doctors' fees earn compared to what JNF earn, is an imbalance. And it is the intention of this ministry to ensure that there is some reform taking place so that the institution that provides the base and all of maybe the equipment and material and gloves and everything else gets a fairer share of the revenue. Especially since we're going to introduce comprehensive health coverage. Well, I'm not going to be introducing comprehensive health coverage to ensure that doctors, I know you deserve more doctors, don't get me wrong, I know you deserve every penny that you earn, but that while you earn, the institution does not earn. The institution that provides this service to all of us, including the doctors, must also benefit from this program. In other words, the $60 million that health costs this country every year, costs the government in particular, nurses, doctors, everything else, must be balanced I don't think it ever will be balanced, but they're a bit more, the scale must tilt a bit more, where revenue to the government gets an uptick to satisfy the huge expenditure on healthcare service and services in the country. So that's reform for you in health.
Did you give a timeline, Minister, in terms
Yes,
of
I at a meeting of the OECS health ministers only about 2 weeks ago, I put on a record that in the year 2016, the comprehensive health coverage, that program will be in place. At this point, I can't say how it will be introduced. And let me explain that, because rather than people twist what I say, I am going to have consultation. I'm not making a decision on my own. I am going to put a team of people out there to consult throughout the entire country to see what the country thinks that we need and what they're able to support, whether financially or otherwise. A decision will come for its implementation when the country speaks, not when Eugene Hamilton speaks. But I want to ensure that it happens in 2016. So that expect consultation, and I encourage everyone in the country, when the consultation starts, to get engaged in the consultation. Don't speak when the consultation is over if you have not contributed to the consultation. The whole approach of the Team Unity government, Mr. Williams, is one of consultation. Consultation, we've said that in our memorandum of understanding when we got together. Consult, collaborate, communicate, consensus. So we are going to encourage consultation before we implement. That will start very shortly, and consultation is expected. Meanwhile, individuals who I know are looking forward to an early start can be assured that we have a starting date. And I said I don't know how it will be implemented because how it's implemented comes from the consultation. It may mean that you may have to do it, say, by tiers, by stages, rather than one time. We don't know that until the consultation is over. And the consultation informs us, we will then act. But that I expect in 2016.